Over 60, improve blood flow in your legs with this vitamin. Often, as we enter our golden years, certain bodily sensations might arise that we casually dismiss as simply a part of aging. These can include a subtle tingling in the extremities, particularly the feet, which can feel like a persistent pins and needles sensation. Another common complaint is the occurrence of muscle cramps, especially during the night, disrupting restful sleep and leaving us feeling stiff and sore. Then there's that unmistakable, heavy, dragging feeling that descends upon our legs as the day wears on, making even simple movements feel like a considerable effort. While these experiences might seem minor, they can actually serve as crucial early warning signals. They are not merely inconveniences, but rather early indicators that your circulatory system might be encountering difficulties, a silent struggle that, if left unaddressed, can pave the way for more serious health complications. Ignoring these subtle whispers from your body could potentially lead to the formation of dangerous blood clots, which can impede blood flow and cause significant damage. It could also result in nerve damage, manifesting as persistent numbness, weakness, or even loss of sensation, or, in the most severe cases, contribute to a stroke, a life-altering event. In the span of approximately 9 minutes, this informative discussion aims to shed light on 5 distinct warning signs that your body is already signaling compromised circulation. More importantly, it will unveil 4 essential vitamins, nutrients you likely already have readily available in your kitchen that possess the remarkable ability to help reverse these issues naturally. The first of these vital nutrients is vitamin B3, more commonly known as niacin. This is a cornerstone nutrient that plays a pivotal role in naturally expanding your blood vessels. This vasodilation is critical because it eases the passage of blood throughout your entire body, significantly reducing the likelihood of blood clots or blockages forming within the arterial pathways. This beneficial expansion of blood vessels allows for a more efficient and robust delivery of oxygen and vital nutrients to all your body's tissues, which in turn helps to alleviate common symptoms associated with poor circulation, such as that persistent leg fatigue and the unwelcome cramping. Beyond its direct impact on blood flow, niacin is also a champion of heart health. It actively contributes to lowering levels of LDL cholesterol, often referred to as the bad cholesterol, while simultaneously working to increase levels of HDL cholesterol, the good cholesterol. This dual action is instrumental in preventing the buildup of fatty deposits within your arteries, a key factor in the development of atherosclerosis. You can readily find vitamin B3 in an array of delicious and accessible foods. Excellent sources include skinless chicken breast, eggs, salmon, tuna, and almonds. To put its potency into perspective, a mere 100-gram serving of chicken breast can provide you with over half of your recommended daily niacin intake. However, before we delve into the remaining 3 vitamins that can significantly bolster your circulatory health, it's important to understand the underlying physiological processes that occur within your body when circulation begins to falter. Consider your body's blood circulation system as an intricate highway network. When this system is functioning optimally with smooth and unimpeded flow, oxygen and essential nutrients are efficiently transported to every single cell, fueling your body and leaving you feeling energized, strong, and vibrant. Conversely, when circulation starts to decline, the initial signs are often subtle and easily overlooked or misinterpreted. Poor circulation, in essence, happens when the flow of blood becomes sluggish or is obstructed, with the feet and legs being particularly vulnerable areas. The array of contributing factors is diverse and can include the gradual buildup of plaque within the arteries, a condition known as atherosclerosis, the weakening of the valves within your veins, which are responsible for ensuring unidirectional blood flow back to the heart, elevated blood pressure, which places undue strain on the vascular system. diabetes, which can damage blood vessels, a sedentary lifestyle characterized by a lack of physical movement, or even the natural process of aging, which can lead to a decrease in vessel elasticity. What makes this gradual decline particularly dangerous is its insidious nature. It often develops without significant pain or obvious symptoms in its early stages. Swollen ankles, persistently cold toes, or minor, transient discomfort are often brushed aside as inconsequential. However, these are in fact serious signals from your body. When blood vessels lose their inherent flexibility and ability to contract and relax effectively, the risk of blood clots forming increases dramatically. Without proper and consistent blood flow, your body's ability to effectively flush out metabolic waste products and toxins is compromised, leading to an increase in inflammation throughout the body, a heightened susceptibility to infections, and an accelerated rate of cellular aging. Professor Dr. Joel Kessler, a recognized authority in the field of underlying problem of reduced blood flow. The third symptom that frequently arises is persistent tingling and numbness, particularly in the feet. This sensation, often described as akin to pins and needles, especially after prolonged periods of sitting or standing, is not simply a result of poor posture. When this tingling and numbness becomes a regular occurrence, it strongly suggests that the nerves in your feet are under stress due to an insufficient supply of blood. Over time, this chronic lack of adequate blood flow can lead to peripheral nerve damage, which can negatively impact your reflexes, your sense of balance, and your overall mobility. The fourth critical warning sign is the persistent sensation of cold feet, even when the ambient temperature is warm. If your feet consistently feel icy to the touch when the weather is mild or even warm, it is a clear indication that blood is not adequately reaching your extremities. This occurs when the blood vessels in your legs and feet have become narrowed or even partially blocked, preventing the oxygen-rich blood from reaching your toes. Beyond the sheer discomfort this causes, it signifies underlying arterial problems such as atherosclerosis, and it weakens the natural defense mechanisms of your feet, making them more vulnerable. And finally, the fifth and perhaps most visually apparent sign of compromised circulation is the development of varicose and spider veins. Varicose veins, characterized by bulging, twisted veins that are often bluish or dark in appearance, are one of the most unambiguous indicators of poor circulation in the lower limbs. These veins form when the valves within the veins, which are designed to prevent blood from flowing backward, become weakened. This weakening allows blood to pool in your lower extremities, leading to discomfort, swelling, and that familiar heavy feeling. Spider veins, those smaller web-like networks of red or purple lines, are also considered warning signs of compromised vein health and underlying circulatory issues. Professor Kessler reiterates a crucial point. The most significant mistake individuals make is to dismiss these signs as purely cosmetic concerns. He warns that poor venous flow acts like a silent unraveling of your circulatory system. When this system fails completely, the resulting complications become considerably more challenging to treat. If you are experiencing multiple symptoms, it is highly recommended that you consult with a specialist. A simple vascular ultrasound can effectively identify underlying issues before they escalate into dangerous health threats. And if you are finding the information presented so far to be valuable and helpful, please consider showing your support by hitting the like button. Your engagement significantly aids in the channel's growth and reach. Now, let us turn our attention to the remaining 3 essential vitamins that can play a vital role in naturally restoring and enhancing your circulation. The second vitamin that is indispensable for circulatory health is vitamin C. While commonly associated with boosting the immune system, vitamin C's role extends far beyond that. It acts as a structural protector of your blood vessels. Vitamin C is fundamental in the production of collagen, a protein that is absolutely crucial for maintaining the elasticity and strength of your blood vessel walls. This elasticity is what helps to prevent the formation of varicose veins and other vascular abnormalities. Furthermore, vitamin C is a potent anti-inflammatory agent and a Vitamin K into your diet by consuming dark, leafy green vegetables such as spinach, kale, arugula, and broccoli. A delicious and straightforward method to increase your intake of vitamin K is by enjoying green smoothies. A particularly effective combination includes kale, apple, celery, kiwi, mint, and a small piece of ginger. It is best to consume these smoothies fresh, ideally in the morning. If you are currently taking anticoagulant medications, commonly known as blood thinners, there is no need to avoid foods rich in vitamin K. The key is to maintain a consistent intake of these foods so that your doctor can safely monitor and adjust your medication dosages as needed. And finally, the fourth vitamin that significantly contributes to optimal circulation is vitamin E, often described as the ultimate protective antioxidant for the vascular system. Vitamin E acts as a robust defense against oxidative stress. Oxidative stress is a primary contributor to the premature aging and weakening of blood vessels, as it involves the presence of harmful free radicals that damage cellular structures. By effectively neutralizing these damaging free radicals, vitamin E helps to preserve the integrity and inherent flexibility of your artery walls, making them less susceptible to tears and microscopic damage. Furthermore, vitamin E assists in preventing the formation of blood clots, thereby promoting a smoother and more unrestricted flow of blood throughout your body. One of its additional, often overlooked roles is to enhance your body's natural production of nitric oxide. Nitric oxide is a crucial compound that signals blood vessels to relax and widen, which in turn eases the workload on your heart and contributes to naturally lowering blood pressure. You can find vitamin E in abundance in a variety of nutritious foods. Excellent sources include avocados, extra virgin olive oil, sunflower and pumpkin seeds, almonds, and green vegetables like spinach and broccoli. While vitamin E supplements are readily available, it is generally recommended to prioritize obtaining this nutrient from whole food sources for a more stable and safe absorption into your body. Therefore, it is crucial to internalize this key takeaway. Circulatory issues are not merely minor annoyances or unavoidable consequences of growing older. They are significant warning signs that point towards deeper health problems that can impact your heart, your brain, and your overall mobility and independence. The positive news is that you do not need to resort to drastic or complex measures to address these concerns. You can begin by implementing simple, manageable swaps in your daily routine. Consider incorporating a nutrient-rich green smoothie into your morning regimen. Opt for a handful of almonds as a healthier alternative to processed packaged snacks. Make an effort to include dark leafy greens in your lunch or dinner meals. Choose whole fruits over sugary desserts. These small, consistent daily shifts, when practiced over time, can culminate in substantial and meaningful improvements to your circulatory health and overall well-being. To recap, vitamin B3, or niacin, plays a vital role in enhancing blood flow and is instrumental in helping to maintain healthy cholesterol levels. Vitamin C strengthens your blood vessels by promoting collagen production and possesses significant anti-inflammatory properties. Vitamin K is crucial for keeping your arteries clear of blockages and actively reduces the risk of developing